Welcome back, everybody. I'm Zach, and today we're going to go over some Naplex topics again today with asthma. This is getting that medical degree where we talk about other medical topics such as pharmacy, medical school, and really anything to get us into medical school, like our journeys and really our backgrounds. My background is in pharmacology. I graduated with the doctorate in pharmacy. So, the Naplex is the test you take to become a pharmacist in the U.S. So without further ado, let's get into this topic. It's also really important to know when you go into medical school as well, because asthma is super big. So you really need to know this topic really well. So just get into some of the main things about it. You have the severity of asthma. So intermittent is less than 2 days a week, less than 2 days per month at night. You really need to know these like the back of your hand because they could change one thing in the sentence and it could really mess up what your answer would be on the test. So mild is greater than 2 days a week, but not daily. That's 3 to 4 days per month at night, 2 plus exacerbation needing steroids, and a normal FEV. So they could say, hey, you're having 2 exasperations, but you're having FEV of 60 to 80% on the test. So that automatically puts you in the moderate group. Or if you're having it daily Saba use, that's automatically putting you in the moderate group. And now saying you're having 7 times a night, you're being severe. So like, all you need is like one of these things really, put in the category. FEV less than 60%, but you're only using it like a couple times a night, well, you're probably still severe because that FEV is pretty important. See what I mean? They change one thing in here and it messes up your entire answer. Let's go over it, go fully through it this time. So mild, greater than 2 days a week, but not daily. 3 to 4 days a month at night. 2 exasperations, 2 plus exasperations needing steroids, normal FEV. Moderate is daily Saba use, so using your albuterol every day. Using it more than 1 time a week at night. Some limitation, FEV is about 60 to 80%. You also have exasperations. Severe throughout the day, every single week, 7 times a week at night. And pretty much FEV is less than 60. So really, they could throw any of that in different combinations, and you pretty much go by the most severe on your test. And then your treatment algorithm. So this is, if you know the stuff I just talked about, it's pretty easy. So intermittent, as needed, low dose ICS plus formoterol or low dose ICS with SABA. Mild is daily ICS or as needed ICS plus formoterol. Moderate's where you get into the combination of ICS plus LABA, low dose. Severe is medium dose and high dose, depending on how severe it is. On screen is actually what the algorithm actually looks like. That's for children 6 to 11 years old. And then that's for 12 and up. Screen for a second. So beta agonists. So beta is where they're working at. So that's the beta receptors. So the side effects: nervousness, tremors, and tachycardia and palpitations. Why would you have that? So beta cells or beta receptors. There's beta 1 and beta 2. Beta 1 is in the heart. So these are agonists, so they're actually like antagonizing it, like activating that receptor, which causes the heart effects. So like tachycardia, palpitations, tremors, nervousness. That's from beta 1. Beta 2's in the lungs. You have 2 lungs, so beta 2. Get it? So just remember that. It's not selective, so it activates both. It also can cause a cough and also hyperglycemic, so it increases the blood sugar. Also can lower the patient's potassium, so hypokalemia. MDI is a meteor dose inhaler. You want to shake well. Inhalations aren't too important to know that. The brand generics is probably the most important part. So albuterols can be ProAir, Prevento, Ventolin, HFA. Levalbutyl, Zopanex. Don't use LABAs alone because they can increase risk of asthma deaths. Only use with ICS. Next up is inhaled corticosteroids. Main thing to know is wash the mouth out after use, and the brands. So budesonide is Pulmicort. Now, if you add formoterol into this in the mix, it's called Symbicort. So budesonide plus formoterol is Symbicort. Budesonide by itself is Pulmicort. Fluticasone is Flovin or Arinity. Plus Somaterol is Advair, or plus Valentrol is Brio. Mometazone is Asthmanex. Add formoterol into the mix, it is Dulera. And then you have that weird one at the bottom. So do you guys remember what these are? So what's Pulmicort? So Pulmicort is budesonide. Symbicort. Symbicort is your budesonide plus your formoterol. Advair. So what's Advair, guys? You remember it? This is a really common one you see when you test. So this is your fluticasone and salmeterol. Dulera. Mometazone, which is Asthmanex, plus formoterol. And I just gave away Asthmanex, which is mometazone. Llama is tiotropium or sprivorisomat. You have some leukotriene agents. So montelukast is singular, black box warning for neuropsych. Theophylline's range is 5 to 15, measure the peak. You're changing the amino one to theophylline, multiplied by 0.8. And it can cause vomiting, arrhythmias, seizures, and vision changes. So watch out for that. Omalizumab is Xolair. It can cause anaphylaxis, so administered in a healthcare setting, at least for the first dose, first time using it. MDIs, shake well. You can use a spacer if you need be. Not too much there. DPIs, discus, ellipta, handy inhalers. These are dry powder inhalers. No spacer needed. Don't no shaking. So, and then cleaning a spacer. Warm soapy water. Clean weekly, and then you want to clean the peak flow meter weekly as well. Speaking of peak flow, green zone is 80% of your personal best. So follow what you're doing. Your personal best is if you're 60 to 80% of your personal best, you're getting worse. So you might need to increase your rescue use or increase your meds. And less than 50% of your personal best, emergency room now, stat, go. Okay? Hope you guys learned something new. Comment below what you learned and what you want to hear about next time. See you next time. Peace.